So I get asked often about Dupuytren's contracture. There's a layer of tissue underneath the skin in our palms called fascia. It's attached to the skin. You can imagine if the skin on our palms moved like the skin on the back of our hands, it just wouldn't be very conducive to grabbing and holding objects, such as a golf club or a tennis racket or even a hammer. There's a disease process where that fascia shrinks for no good reason at all. We call it Dupuytren's contracture, named after a famous French surgeon. Usually it's a cord-like contraction, most commonly in the ring finger, second most commonly in the pinky. That contracture will progress slowly. No one can predict how quickly it will progress. There's nothing to do to prevent it or even slow down the progression. And I tell patients, once I educate them on Dupuytren's, that the easy way to know when you'll need surgery is when you try to put your hand flat on the table and it doesn't go flat. At that point, it's time to go ahead and cut out that cord. You don't cure the problem. There's still plenty of normal fascia that's left behind that can contract, but you don't need to be operating on it every year. Most patients will have 1 or 2 surgeries in a lifetime to fix the problem, and that'll be it. And we'll continue with relatively normal function. And in fact, if you want to have a nice little project, go look up some photos of Ronald Reagan. He had bad Dupuytren's contracture in his left hand and never got it fixed. Didn't bother him. He was still a great president. But he would wave with his left hand, and you can actually see the Dupuytren's. Look it up on the internet.